I came to the University of Rochester to become the inaugural chair of the Department of Health, Humanities, and Bioethics because to me it was very important that this was the home of the biopsychosocial approach. We have to think beyond just the medical reduction approach and really think about the social determinants of health, the environment, the relationships, family, community. Every clinical encounter is a moral encounter, and so wherever you're involved in health and patient-doctor relationships, you're involved in ethics. And so ethics just integrates across every part of medicine.
There's so many people in different places on campus who do different things. And Lainey has a knack of bringing them together and bringing them in the same room, bringing them together for a lecture series, bringing them together for a talk.
Within my first week of coming here, I crossed Elmwood Avenue in order to go to River Campus because I realized that, again, in order to think about the patient as a person, we need the whole humanities. We need a much more interdisciplinary and multidisciplinary approach.
The summer before I started as the director of the Humanities Center, a close friend of mine had been diagnosed with stage 3 brain cancer, and I was really struggling at the time and started thinking pretty deeply about grief. And so when Lainey reached out to me, I kind of threw this against the wall to say, do you think about grief? And she said, oh yeah, all the time. I mean, this is central to the kind of clinical experience, and doctors have to navigate grief all the time.
And so we realized that it had such a powerful impact on both our health as well as in the humanities. The arts are such a great way of thinking about grief. And so we started this collaboration, and we've been inviting people from poets to clinicians to historians, as well as to other types of artists.
So Lainey makes sure that all things are considered. Her work isn't just something that stays in the ivory tower. It's something that is relevant to each clinician and practitioner in the hospital. And I think we're very fortunate to have her on board.
I think one of the hardest things for medicine is that we've lost a lot of trust, and one way to rebuild trust is to have improved communication, doctors who express empathy, and part of that is what the humanities and ethics can teach us.